Welcome back at 8:13. Xylitol is a popular sugar substitute commonly found in sugar-free gum, mints, sometimes even toothpaste. But a new study says it could be linked to increased risk of heart attack and stroke. Dr. Reena Mehta with Uptown Allergy and Asthma joins us with details on this study and its findings. Dr. Mehta, good morning. Thank you for being with us.
Good morning. Thank you for having me.
So where was this study conducted?
So this study is published in the European Heart Journal. It was a Cleveland Clinic study where they looked at basically people who consume a lot of xylitol and what are the risks. So when we think about xylitol and sugar substitutes, those are the people that are going to have it are your diabetics, the people who are trying to cut down calories, the people who might already have high blood pressure. And then we're slowly finding over the last 10 years that maybe these sugar substitutes aren't as safe as we think.
And xylitol, I was just kind of getting clarification from you in commercial break, is not the same thing as some of the other sweetener substitutes. It's its own standalone thing, but it's more common in Europe, you said.
Exactly. So they're all very similar. Xylitol, erythritol, they're all similar. But xylitol is used a lot in Europe. We see it in baked goods, candies, gum, toothpaste. Also in a lot of keto-friendly diets, you'll see it listed as xylitol. And so what the study found was that those people who produce more xylitol in their body, because it is a natural substance that you do produce, those patients were more likely to have a heart attack or stroke within 3 years.
The one thing we also wanted to clarify and put across to our viewers this morning was, don't freak out. This is just one study. Other studies need to be done, and we're not telling you to stop using this. We're just telling you that
to be aware, and maybe you want to think about more natural forms of sugar, things like honey, maybe maple syrup, things like monk fruit, other ways to naturally sweeten your food rather than just going straight to your sugar substitute. So there is a proposed mechanism of why they think this might happen. So xylitol, when they looked at mice studies, they looked at what xylitol versus regular glucose does to the animals, and what they found was that xylitol activates platelets, and platelets are your cells that cause clotting. And if you have clotting in your heart, it can increase the risk of heart attack. And if you have clotting in your brain, it can increase the risk of stroke. They did not find the same thing with regular glucose or regular sugar.
So a conversation needs to be had, as always, with your doctor if you've listened to the results of this study now and you have some concerns about some other, as you mentioned, other options, more natural options, which are out there.
Absolutely. Toothpaste and things like that, small amounts, fine. We're not telling you to totally cut it out, but I mean, if you're using sugar substitutes quite a bit, you might want to talk to your doctor about other options, because especially if you're already at risk for heart disease, you definitely want to think about other ways to prevent that.
I forgot to ask you earlier on about how many people were a part of this study.
3,000.
3,000 in Europe, correct?
Yes.
Wow, interesting. Okay, well, Dr. Mehta, thank you so much. It's interesting findings. You always come up with such interesting information and studies that are going on all around the world. So we appreciate your time as always.
Thank you for having me.